that afternoon when I got home, my brother was sitting at my house, my sister, and then Frankie was there, and I'm going, where's Jovan? Where's Jovan? She goes, well, we gotta go to the hospital. I'm going, what? So what happened? That's how I found out that he was sick, and I went to the emergency room, and the door opens, and it's Dr. Navsaria. He goes, he's in good hands, so how are you? And after that, I took a step back, and it just hit me that it wasn't just about him, my son. It was like he wanted to make sure that everybody was okay. I'm from Madison originally. I grew up here. I've been here for most of my life. I left for a while, and then I came back. I've been into a lot of bigger cities, but I've always come back here to Madison, mainly because my family's here. This is always going to be home.
This is a sibling pair that first came to me last July of 2010. These kids were living for the last few years in another state with their mother. The boy had asthma, was on multiple medications, and so on and so forth. Well, their mother came down with leukemia and died last year. Huge upheaval because they didn't expect any of this. They're 11, they're kind of right in that middle age there.
You got to go to Access, and Dr. Navsaria was the first person they saw, and that's probably the only person I'll allow them to see because he's just great. I can't really, like I said, I can't say enough about him. The people at Access have been really great, especially at Dr. Navsaria. When Jovan got sick, we basically found out after he had just a regular checkup because he was having some problems at school where he was throwing up and having vision problems. So we didn't know what it was about, so we thought, we'll just have him checked, find out what's going on. And Dr. Navsaria said, why don't I just order a whole plate if it's not high blood pressure, if it's not this, if it's not that. We can start weeding out and then we can narrow it down.
And it's his blood count. His hemoglobin is half of what it should be. Like, if mine was what it was, I would be lying on the floor unconscious. And I'm looking at that and going, you've got to be kidding me. And then the next blood work comes back, and it's his kidney values. Sky high. Like, so crazy high that I can't even believe these values. This kid is incredibly sick, like one of the sickest walking around kids.
What they did is called school and had him rushed from school straight to the emergency room. Maybe around 7:30, the door opens and it's Dr. Navsaria. When he came into the emergency room, and then he goes, I just want to make sure that you were okay, And again, that kind of dumbfounded me right there for a minute because he didn't have to come there. But he said that he mainly came there to make sure I was okay, make sure that my mind was okay, so that the battle that I would have to fight, that I was prepared for. To me, that was like the most wonderful thing. And after that, it's like sometimes I get choked up about it. And if you saw him today, you don't know that he's sick. And that's what I keep trying to instill in him. I said, you're not really sick, you just have some things wrong with you that we need to fix. So I don't allow him to, feel sad about, I'm, got this tube in me and this, and I don't let him do that. We're actually trying to get him a new kidney so he doesn't have to worry about that. So he's on the list. That's gonna hopefully happen before the end of summer. Frankie's also going through some testing and stuff like that just because she's a sibling of Jovan's. And they want to make sure that she doesn't have the same issues. So if we can find it early, then she doesn't have to go through the same process that he's going through right now. Due to the death of their mother, I put him in touch with the behavioral team at Access. The people are lovely. Like I said, they're professional and also they're caring. And that's one thing I can say about Dr. Navsaria, that he showed me that he's not only doing his job, he actually cares about his patients. And that's a really, really big thing with me because I have nothing but praise for him. I can't give him enough praise.
I think there's so much more of an accountability to the public, to saying this, it's in the name, it's a community health center. The very mission of a community health center says we have to help people. It's kind of nice to work somewhere where everyone's sort of agreed, hey, there's a good reason for Access to exist, and we want to help Access exist and do its job, because we realize that it collectively benefits us all, that this is reducing our ER visits, this is reducing our inpatient stays. Oh, and by the way, it happens to be better for the patient. You know, it makes a whole lot of sense.
I'm in your guys' corner because you guys have been in my corner, so.